Hello, I'm Dr. Bracci, and welcome to the Ageless Raid Show. Today's episode will focus on 5 major reasons some celebrities look fake and how to avoid this look. The first and most common reason by far is that they had permanent changes made to the face, such as plastic surgery. Whenever the face is cut and tissues are pulled, there's a real risk of not only looking different immediately, but an even greater likelihood of making the face look less natural over time. The key is that our face is naturally ever-changing, and making a drastic repositioning of the structures of the face today with surgery has a high chance of not adjusting naturally as we mature. The second most common reason some celebrities look fake is the overuse of the soft type of fillers, such as Juvederm, Restylane, and Voluma. These type of fillers are by far the most common types of fillers injected, mainly because they're technically easier for the injector to inject, but they tend to make the face look puffy and round if used more than small amounts. The reason is that these soft fillers tend to hold water. In addition, the common practice of going from different provider to different provider to get what's some called a top-off of soft fillers is likely to leave you puffy and round due to this water-retaining property. And the fact that you're seeing too many different providers for these top-offs instead of sticking with one provider for consistency of care. The third reason is the lack of use of the firm fillers. Firm fillers such as Radius and Sculptra are technically much more demanding to inject, but they provide a much more natural, stronger lift to the skin and overall better improvements. If a provider does not offer these fillers at all, there's a real limitation on the scope and the amount of lifting and correction that can be accomplished. The fourth reason, which I'm very passionate about, is when the whole face is not treated or even considered, there's a tendency to look less natural. Why is this important? As we mature, we lose support underneath the skin in the entire face. And all too often, providers not only rely on the soft fillers, but they commonly only treat limited areas of the face, such as the mid-cheeks and the nasolabial folds, without getting results and lifting to the sides of the face and the jawline and the under area of the cheek. By focusing only on limited areas of the face, all too often the face is unbalanced, with some areas overcorrected and other areas obviously undercorrected. Let me illustrate to you. This gentleman had a full face correction, and his treatments were not limited only to the nasolabial fold and the mid-face, but laterally had a jawline, a cheekbone correction, a jawline correction, and he had his chin corrected and underneath the chin. So basically there's more of an aesthetic improvement because we're improving the natural ratios of the face without limiting the treatment to specific areas. So there's an overall improvement. The fifth reason is you need to understand is that you're not just purchasing simply the ingredients, but the aesthetic experience and the vision of the physician. A celebrity doctor may not necessarily be the best fit or experienced injector with aesthetic sensibilities and not likely to provide cosmetic injections on a full-time basis. There's experts for everything, so choose wisely and for long-term continuity of care. Ideally, select a provider that is solely dedicated to these treatments on a full-time cosmetic basis and not limiting this to part-time basis. Thank you for watching.